Hi, I'm Dr. Thais Aliabadi. For over 25 years, as an OB-GYN, I've helped countless women navigate the challenges of PCOS. I created OV to bring you a scientifically backed solution that supports the symptoms of PCOS with powerful ingredients. OV supports hormone balance, body composition, metabolic support, and beauty from within, giving you a comprehensive approach to supporting your health. It's more than just a supplement. It's a product born from decades of experience and a deep commitment to women's health. Visit OV.com to learn more and start your journey to better health today. That's OVII.com.
Hello, listeners. Mary Alice here. On this episode of SheMD, our guest is Sarah Hoover. She's an accomplished art historian, cultural critic, and the best-selling author of the book, The Mother Lode, Episodes from the Brink of Motherhood. It's important to me and Dr. A that we protect our listeners, so I'm putting a content warning ahead of this one. In her book and in our conversation, Sarah speaks candidly about her experience with sexual assault and suicidal ideation. The good news is that Sarah eventually found doctors who listened to her and helped her find solutions for her symptoms. If there is any chance this subject matter will be triggering or upsetting, you may wish to skip this episode or engage with it at your own pace. As always, thank you for listening to SheMD. We are working hard to bring you episodes that move forward even the most challenging topics. Now, here's our talk with Sarah Hoover. Sarah Hoover, I'm so excited to have you on the podcast today.
Thank you so much for having me.
You have a brilliant book that just came out, The Motherhood, Episodes from the Brink of Motherhood. And it's packed full of incredible stories, and they're all based on your life. So is this a memoir?
Yeah, my book is memoir. It's, narrative nonfiction. So there were certain liberties I took because I changed people's names and the dates on some things didn't quite make sense for publication. So I made the story more legible. In fact, as I remember it, it was a very turbulent year for me that I write about. So when I went back and compared my notes to my calendar, there were things that I remember differently because I was so out of my mind. Yeah. But I wanted that to come across in the book. It was important for me that be a part of the narrative. So it's very true to the emotional roller coaster that I wrote.
And everybody, you should read it because it's witty, it's fun, it's heartbreaking, it has a lot, all of those things. But you were an art historian, and you were living in New York, and your husband's an artist, right?
That's right. Yes.
And you were kind of living the dream. And can you kind of walk us through how you got pregnant and you had this baby, and that's how this whole journey started?
Yeah. Well, I moved to New York, after high school to go to college, and I went to graduate school there, studied art history. I was working in a large international art gallery, kind of had my dream job, and I met my husband through work and fell in love with him. And I followed the path that I think we're all kind of taught is the right one. You get married, you get pregnant, you have a baby, and sort of without any criticality or thought about what that really meant to me, I followed along. I wanted to be a mother. I wanted to have a family, but I wasn't one of those young women who was obsessed with babysitting. I didn't love little kids. My heart didn't explode when I saw a baby. I imagined myself with a family one day, but when I found myself pregnant, I was 33 when I had my first child. I was like, all right, well, I guess I do this now. But I hadn't really spent a lot of time conceiving of what my life would look like as a mother and what I wanted it to look like as a mother. I was left broken by the experience I had being pregnant and giving birth to my son. And after, 19 hours of labor, when they pulled him out and put him on my body, I was so traumatized by the experience that I had that I just did not connect with him in any way. And it plunged me into a year-long postpartum depression that only ended with me realizing I was going to kill myself if I didn't get some sort of treatment. And I'm really fortunate that I figured that out before it was too late.
And by the way, this story is something that you probably hear quite a bit, and we're going to talk about postpartum and more of the medical aspect of it. But you get pregnant, your pregnancy is normal, it's fine. No complications during pregnancy. Did you like being pregnant?
There were things about it that I liked. I felt like I had this little secret at the beginning that was just mine. There was something romantic about it that I felt with my husband, like we had really done something together. I was excited for this new chapter of my life, though I didn't really understand what it meant. And, there was a certain point where I felt really cute. Like I swallowed a basketball and I was pregnant in the summer in New York and I was walking around in mini dresses with my big belly. And there were other aspects of it that really broke me. Like I had terrible nausea until 20 weeks with my first pregnancy. And it was really lonely. I didn't have many friends who were pregnant or who were already mothers because in New York, people tend to get pregnant later. So I felt pretty lonely in all of it. And I felt my brain felt different, felt slower. And I was, still working at the gallery in the time. And my work was incredibly important to me. I got a lot of fulfillment out of that side of my identity. And I was terrified to have to take a maternity leave. I didn't want to. I wanted to stay working because I was scared to give up that part of myself. So there were like aspects of pregnancy I liked, but I also, in retrospect, feel like I was depressed during pregnancy. I'd always loved to go out to lunch or have a drink with a friend, and I kind of couldn't do a lot of the things that I was used to doing that made me happy, and that was hard for me.
And then what happened with the birth? I mean, all of a sudden, did you go into labor? Did they have to,
Okay, so I, on my due date, went in for my weekly checkup. At the end, you see your OB once a week, right? And she was like, yep, shop's closed, not dilated. Come back tomorrow. We'll check you again. And I said, oh, FYI, I've been peeing in my pants a lot the last 10 hours. I woke up in the middle of the night last night to pee and I've been peeing in my pants a lot. But I was pregnant. I peed in my pants all the time,
I still pee in my pants.
Yeah. It's been a delight. It's never stopped. So she was like, I'm just going to swab you. Anyway, it turns out it was amniotic fluid. Mm-hmm. She was like, I think you have, a tiny tear in your amniotic sac and you're leaking fluid. And if that started last night, then likely, it's been 15 hours or whatever that your fetus has been kind of exposed to the germs of the world. And I want to get you in a hospital and we want to induce you right away. And I was like, well, I couldn't possibly do that because I have to get my roots done. And I will be going to the hair salon to get my roots done. And she was like, no, you won't. You'll be going right to Weill Cornell. So I was terrified, and all I could think of was I can't have a baby with dirty hair, which just shows you how out of my mind I was, I was delusional. So anyway, we had negotiated. She let me get a blowout. She sent me over to the hospital immediately after the blowout. And I remember sitting outside and sobbing and calling my best friend and panicking and being like, I'm going to die in this hospital. I can't go in there. I'm so scared. I just had a horrible feeling about it. And I went in. I forced myself finally to go in. And nothing weird happened in my labor and delivery. Alarms didn't go off. I didn't have to get wheeled in for emergency surgery. And yet, the experience I had in that hospital traumatized me. It triggered my memories of sexual assault that I had experienced before. I felt like no one was really my advocate. I had my husband there, but, he didn't quite know how to be helpful. He felt useless in a way because he didn't know what to say either. And I felt really at the mercy of a doctor who I wasn't sure. I knew that she had my best interest at heart in terms of wanting me to walk out alive and wanting my baby to be alive. But I could sense that she perhaps did not prioritize my mental health and how I was feeling as I was going through the process of giving birth. She did something that I think is probably very common. She broke my water fully. And to do that, she used this, what looked to me like a metal hook, like a long, like a knitting needle with a hook on the end. And it was incredibly painful for me. And I've Googled this to the end of the earth. I have reached the bottom of Reddit Googling this procedure. And it doesn't hurt everyone. But for whatever reason, it hurt me and it terrified me. And I screamed and I cried and I was shaking and water gushed everywhere and blood went everywhere. And she looked at me and she said, I've done that 2 times this week and you're the only person that complained. And in that moment, I thought to myself, she doesn't care. how that made me feel, because I believe her that it didn't hurt the other people, but it hurt me, and I wasn't faking it. And I wanted just like an ounce of empathy from someone. I just wanted her to say, I understand that really scared you. I'm sorry. It usually doesn't hurt people. I got you. I'm going to take care of you. I'm sorry that happened. There was no like warmth, you know? I just felt really like gaslit by what she said. And I remember thinking to myself, you better shut down the part of your brain that expects this to be like beautiful and special, because you're at war and you got to get this baby out and you got to walk out of here alive, but no one has your back. And I remember forcing myself to like almost divorce myself from having any emotion about what was to come. And because of that, I think when the baby came out, I was not equipped to fall in love with him the way I thought was natural for a new mom. I thought the minute the baby came out and you met your child, that you became a mother and that hormonal fireworks went off and you fell in love, and it was so blissful that all the tasks of mothering would come to you naturally and feel fulfilling, and you'd be happy and it would all be wonderful. And I felt nothing. And I thought I was a freak. And I felt like such a failure of a woman. And I thought, good girls don't feel this way about their own baby. They're in love with their kids. I'm a monster. And it just set me off into this spiral of like doom and darkness that became this long postpartum depression journey. It only got worse from there.
And during that year, before you really realized, you've got to get help, had you seen a psychiatrist? Had you talked to anybody about it? Had you tried medication?
I had never tried medication in my life. I had a huge stigma against it. I ended up going on antidepressants when I was suicidal, and they were a godsend. I'm not on them now. I've been on them. I've been off them, situationally. I had been in therapy before, but I had never really connected with a therapist. I had never really felt, oh God, this is my person. She's going to change my life, Now I'm really fortunate. I have like 3 therapists that I feel that way about. But at the time, I hadn't been able to develop that relationship yet. And I was scared to tell anyone how I felt because I had so much shame.
And how old were you when you were sexually assaulted?
Well, I've been sexually assaulted multiple times. The time that I wrote about in my book was in my early 20s. And to be honest, like, I think that's incredibly common with women my age. If you're dating in your 20s, likely something has happened to you that you didn't want to happen and you didn't know how to say no. We're not equipped to learn how to say no. I still have a hard time standing up for myself. I'm 40 years old. Everything I've learned in this life, I have a hard time being seen as not polite and not well behaved. And I struggle to find the right words to stand up for myself, particularly with men. And I didn't know how to get myself out of tricky situations. And I found myself in several of them, and I talked myself out of being able to even say the words, you were raped or you were assaulted, because I had shame about that too. Yeah. For years, I couldn't say that at all. And then there were more years where I couldn't say it without crying. And now I can like talk about it all day long, like I've cracked the code, but there's a lot of shame associated with being harmed by a man in that way.
Can I ask you a question? Because you've delivered, how many babies have you delivered?
A ton. Thousands.
Thousands and
So
thousands.
amazing.
If she had been your patient, let's just say.
I would have diagnosed her after 14 weeks when she said, I'm still nauseous. Because I will tell you, majority of the time, and I've done a lot of deliveries, and luckily I don't have any stories similar to yours, but I would have, first of all, read your affect, because, usually patients who continue to have nausea and vomiting past 12, 14 weeks, it's a red flag for me. And the first thing I always ask them is if you're anxious, because anxious patients tend to struggle with nausea and vomiting during pregnancy.
Really?
Yes.
Oh, I didn't realize there was some sort of correlation.
It's Aliabadi correlation. I actually had a patient who, she was like 22 weeks and she kept calling me. She's like, I'm vomiting. I called her. I'm like, I want your husband to come in with you. And I said, are you anxious? She looked at me. She's like, nope. I looked at her husband. I said, is she anxious? And then he looked at me. He said, not only she's anxious, she's so depressed, she has suicidal thoughts. And I was like, that's why you're vomiting. That's why the nausea medications are not working. I already knew the answer, but I have to hear. I can't, you can just assume as a doctor, right?
Of course, yeah.
You need the patient to admit to it. For her, I immediately started her on an anti-anxiety medication. And within 4 weeks, she stopped vomiting completely. And can I tell you, she went probably to so many GI doctors for stomach issues. One person would say, this is acid reflux. One person would say, it's your gut microbiome. It's pregnancy. It's this, it's that. It was any of it. So the first thing you told me that was a red flag is that you were still vomiting at 20 weeks. So my alarms would go off at that point with you, number one. Number two, I always ask about history of abuse. Women with history of sexual abuse, you can sit here and tell me it's not traumatizing. To all of us, at our core, it's the biggest trauma we can possibly experience. And there's nothing darker and uglier than that. And even if you learn to deal with it and suppress it and push it down, it will always live inside of you. Pregnancy triggers that. When you're pregnant and your hormones shift, you already are coming in with PTSD and trauma, which is associated with anxiety and depression. You're already vomiting a lot. You're having a miserable pregnancy to begin with. I just want to clarify, rupturing bag of water can be extremely painful. The act of popping the bag doesn't cause pain, but you have to put your fingers in the vagina. You have to open up the cervix. You have to put the hook in and rupture the bag. The bag itself has no pain fibers, but my fingers in your vagina are extremely uncomfortable. So I just want, for anyone listening, rupturing bag of water, the actual hook on the bag doesn't hurt, but you have to put your finger in there, open up the cervix, push all the way up, get to that bag, and it's extremely uncomfortable. And it's not just you. I've done 8,500 deliveries. My way of inducing is, induction is when you want to, someone like her comes in or you want to stimulate labor. I usually give my patient fentanyl to completely take the pain away. Then I put the Foley balloon in for induction, which is basically you put a Foley through the cervix, balloon it up, I tape it to the leg. We keep pulling on it. The minute the Foley comes out, I give my patient an epidural. And only after the epidural is activated, I go and rupture the bag of water for two reasons. One, the act of rupturing is painful for especially someone having their first child. If you have 3-4 vaginal births, yeah, it's easier for you to tolerate it. But with the first, when the vagina is so small, it's very uncomfortable. And number two, once you rupture that bag of water, the contractions become so strong. You better be ready because you don't want your patient to start screaming in pain and then offer them an epidural. That's why I listen to you. I'm like, it's such a shame, and I was telling Mary Alice when she told me you were coming and you had a bad experience in labor. And I told Mary Alice, I'm like, I don't want to sound obnoxious, but I will tell you it's almost 98% provider dependent. Who your doctor is, who the nurses are surrounding you, and how they listen to you is everything. Now, I don't negotiate. So if you come to me with a birth plan and it doesn't make sense, I say bye-bye. Day one, I say I'm not the right doctor. I'm that pilot on the plane that when you come into my plane, I say, go sit in the back, put your seatbelt on. I will promise you an amazing delivery, but I'm not going to let you land this plane. I'm going to land the plane safe and sound, and I'm going to make sure you have an amazing experience, but I'm not going to let you come in the cockpit and manage the airplane and try to land the plane, because everyone will crash. It's heartbreaking to listen to. You came in with a load of trauma, then you had an uncomfortable pregnancy, then you rupture your bag of water. By the way, you don't pee on yourself 5 times a day when you're pregnant. If you're doing that, you have to make sure your bag of water is not ruptured. But so you were a perfect storm, ready to go into postpartum depression.
Totally.
I would be watching someone like you very, very carefully. And usually I bring my patients back at 2 weeks. 2-week mark, everyone can be depressed, right? We have postpartum blues. Your hormones are all over the place. You're not bonding with your child.
Totally.
So That is extremely common with your first pregnancy. Now with the second pregnancy, you're more likely to bond because you're already a mom, but it is extremely common actually not to be able to bond with your first child. That's why I don't like when doctors say come back and see me in 6 weeks postpartum. So much can happen during those 6 weeks, especially with the mood. So at 2 weeks I usually do a check-in, and usually partners do complain that my wife is sad, she's irritable, she's not bonding with my child, which could all be normal. But in extreme cases, sometimes it starts very early. And when it goes beyond 6 weeks, then it becomes an issue, especially the detachment. Patients don't want to breastfeed. It becomes a chore. And usually we see it in women who either come into pregnancy with family history of depression, personal history of anxiety, depression, women who had complicated births, women who had children with medical complications at birth, twin pregnancies, and patients who basically lack good family support, or detached partners who are not there for them. So all these, how many people can you think of who put a check in front of? I mean,
That's a long list.
That's a long list,
Yeah.
right? So we're all exposed to that. 1 out of 7 women will end up with postpartum depression, and usually it's a red flag if it goes beyond 6 weeks. Up to 6 weeks we can tolerate it. Past that, you need to treat the patient. At least you need to have a conversation about postpartum depression.
When I told my OB, like, I'm still throwing up and it's miserable, my quality of life sucks, and it's 20 weeks and I just want to feel better, she wouldn't give me the anti-nausea medicine. She never gave it to me. She said she didn't like to give it to first-time moms. So that whole time I never had a diclesis or anything. I was just sick. I was so sick. And I remember Googling endlessly, can I smoke weed? Is it going to kill my baby? Because I thought, I don't smoke weed, but I thought maybe that will take away my nausea, because I knew cancer patients used it. I was that desperate. I would have done anything to feel better. I just wanted to feel a little bit like myself, but my doctor wasn't there for me the way you are for your patients. And it's so important. I wouldn't have had postpartum depression if I had had a doctor like you.
I don't know if you wouldn't have, but I would have been there with you every step of the way. And honestly, I always tell Mary Alice, I'm here maybe partly because of my childhood trauma. I cannot see another woman in pain. I just can't do, I'm incapable of seeing someone else in pain. And because of that, I do everything in my power to make sure they're not vomiting, that they don't have pain. They can say, I've had a headache for a week, I'm sending them to a neurologist. I'm like, there's no reason you should have a headache. There are so many levels. You were ready to go into a postpartum depression because of all the other red flags in your life. And with postpartum depression, we used to use SSRIs, right? And these medications actually work. We would put patients on Zoloft or Prozac. We have a lot of studies, and you can breastfeed on Zoloft. And the problem is it takes 4 to 6 weeks for these medications to work. And what are you going to do with a mom? Imagine 6 weeks is a long time when you have it's a lifetime when you have a little newborn at home. But in I think August of 2023, there was a medication, Zurzuvae, that was approved by the FDA. It works like magic. It's a pill. You take it once a day for 14 days. Within 2 to 3 days, you snap out of it. There's IV forms of it, but that's not really doable because you have to admit the patient for 60 hours. It's a continuous IV infusion, which is not really feasible, with a newborn at home. But the pill is approved. It works really fast. If you want to go slower, Zoloft, Prozac work really well. But the problem is patients, first of all, 50% of women with postpartum depression are never diagnosed. Can you believe it? There's a shame to it. They're embarrassed to talk about it. They don't know about it. They've never heard of it. They're not questioned by their doctor, so they don't get diagnosed. And even if they get diagnosed, their doctor is not offering therapeutic medications. These medications are there. We have data on it. It works.
What's the name of the pill one more time? Sorry.
Zurzuvae.
How do you spell it? Spell it.
It's Zurzuvae.
So I have a question again about this. I had always assumed that postpartum depression was because your hormones are so messed
Yes.
up and they're kind of going up and down. So it's a combination of that plus all those other things that you
All
said.
those
But
other
can you
things.
have all of those other things and not get postpartum? And can you have
Absolutely.
all of,
Absolutely. It's a
Okay.
combination of everything. That's why family support is so important. Having a loving, supportive partner is so important. But when you come into pregnancy and you're bringing this trauma with you that had not been addressed, it's just, it's going to overflow. It's like a cup that you keep filling it until it just overflows. So that's why it's so important before pregnancy to address all PTSD. We have treatments to deal with PTSD. And sometimes I agree with you. Some patients, you can sit. I mean, I love therapy sessions. I think it's important for patients, but sometimes therapy alone does not work.
It wasn't enough for me.
Exactly. Yeah. So that's why it's so important. And right now, honestly, with these podcasts, with ChatGPT, even if your doctor is dismissing you, you have the tools to go look up, punch in your symptoms and say, what's wrong with me? But in the world of postpartum depression, you are a perfect storm.
Perfect storm. And I remember Googling postpartum depression and trying to find and ordering books about it and trying to find a description because I knew something was wrong with me during that year. In the weeks after I had a baby, I knew I wasn't right. I knew that my symptoms were not me at my healthiest, but I wasn't just laying in bed crying all the time. And that's what I thought postpartum depression was. My symptoms were weird. Like I was really irritable. I was really angry. I hated my husband. I felt, obviously, as I said, zero connection to my baby. I felt dead inside when I looked at my baby. I had no curiosity about him. I refused to breastfeed. I felt strongly that if I breastfed even one time, even tried it, that I would kill myself. I knew that in my heart. And when I Googled postpartum depression, I read about women who cried. I didn't read about any of those things. I didn't read about not feeling joy when you look at your baby. I didn't read about being irritable and annoyed all the time. So I had like imposter syndrome about my own mental health, I was like, you're not sick enough. You're not sad enough to warrant. And also, I had help at home. And I thought, you're so spoiled. You're so lucky you have like a woman helping you care for your child.
Yeah.
Totally. But in my mind at that time, I thought you have certain luxuries that most people don't. So how dare you? Like, get yourself together and figure it out. So I just relied on, I was like, I'm going to work out and go to yoga and write in my journal and meditate and fix this myself. I don't want to complain. I don't want to be in a position. I don't want to be impolite. I want to be a hard worker who fixes this herself. And there's no way out on your own of something that pernicious.
So what finally happened? It was a year. Did your husband want to just?
Yeah.
He was
we would have divorced,
Yeah.
I remember sitting at my kitchen table looking out at the window, and I live in an apartment building because I live in New York City, and thinking, if I just walked off the window,
Oh my God.
how bad would it be? How messy would it really be for him? And I thought to myself, wait a minute, that's not okay that I'm thinking like that. Like I scared myself, right? And by coincidence, a few days later, I was seeing my GP for my annual checkup. And she just asked me a few questions that were the right questions. She said, how's your relationship with your husband? And I was like, I hate him. He's the worst. I don't know what I'm going to do. Everything he does annoys me. He leaves coffee rings on the counter. And she said, well, how do you like playing with your little boy? He's almost a year, right? I hate it. I don't want to play with kids. That's not for me. That's not how I bond with children. I'm not really a baby person. And she looked at me, and I don't know if it was my answers or what, but she looked at me dead in the eyes and she said, you're in a crisis and you're going to blow up your life if you don't fix it. And I was like, whoa.
Good for her.
Right?
Good for her.
Oh yeah, she's incredible, Dr. Parr. And I said, whoa, really? And she said, yeah, I don't know if you need medicine or you need a different therapist or what. Like it's not really my wheelhouse, but I'm telling you, you're in crisis. I can read it on you. And you got to figure something out. And that, coupled with the sort of suicidal ideation that I was having that I didn't even know was suicidal ideation, but I felt that it was wrong. I said to myself, all right, you got to get a therapist that you really like. So I started researching that and talking to people, and I scheduled a meeting with a therapist. And that same GP prescribed me Zoloft and said, just put this prescription in your purse and, fill it when you can. I'm not an expert, so you might need the dosage change, but let me get you started.
She's a really good expert.
She's totally
I love it.
and a wonderful, caring person,
Yes,
right?
She listened.
She listened.
That's
Hello,
it.
she
She
listened. And it took me a while to get around to filling the prescription, but when that medicine started working,
Life-changing.
absolutely life-changing.
Life-changing.
And I had been so against it. I had been saying to myself for months, because I knew other people who were on it, and I thought, I don't know if it's like where I grew up or my age or what, but I had a real stigma against it.
No,
I thought
it's where you grew up. Same thing growing up in the South. Like nobody was on. Now in California, I'm like, get on everything.
Yeah, take what you can get. Like,
Fix yourself however you can.
I'm Persian. In Iran, they say, well, we don't have any anxiety or depression in the family, period. They just ignore it in the first place. Forget about treatment.
Oh,
They
yeah.
deny
That's like
that
when
it
yeah.
exists.
Yeah. When I got divorced, my parents said to me flat out, no one in our family has ever been divorced. And I was like, wasn't grandmama divorced?
Stop.
Like, I mean, it was literally, yeah. I mean, it's so
Denial.
where you grew up. Deny.
but I just thought to myself, like, this is admitting I'm a failure. It's going to change my personality. Maybe I'll be happy, but it'll be fake happy. I had no understanding of how the medicine really worked and the science of it, and I thought all these things. And then I got on it, and pretty soon I felt this weight lift, and my personality was the same.
What a relief.
It was such a relief. And I had this terrible, of course, I also, on top of everything, had horrible anxiety, which I think a lot of new moms have because you have this vast responsibility. Feels, oppressive almost. And I had this kind of magical thinking where I had terrible nightmares. I watched my son die every night over and over. That started immediately after he was born. I would wake up 5-6 times a night. I watched horrible, gruesome things happen to his body. But I also was scared to like walk downstairs with him, put him in a stroller and go in the street. I hear this a lot from other women. But I had this strange belief that I cannot explain now with a healthy brain, that if I told anyone about my worst fears, that they would come true. And when I finally got on antidepressants, that fear went away. And then I could share the things I was thinking finally with the therapist, because I was going to therapy, but I was like lying. She would say, so do you have anxiety? And I would say like, no, not at all. Because I was so scared that if I said, yeah, I'm really afraid that a car is going to hit me and then no one will be there to take care of my kid, or a car is going to hit the stroller while I'm walking. I thought it would happen. And so I finally told my therapist all of this, and she was like, that's really common. Like a lot of people with severe anxiety have that same trepidation that announcing the anxieties will make them come true, which is a cruel trick your brain plays on you. Like, what is that, But I never would have gotten to a place where I could have talked about that out loud had I not had the antidepressants. And that opened up my whole world.
When people have irregular periods, we say take birth control. Okay. They have acne, take spironolactone. Okay. You have a tooth infection. I'm going to give you amoxicillin. Okay. But the second you say your hormones in your brain are, have shifted and we need to fix it, take this medication for 6 months to a year. Oh, no. I'm not crazy.
Why is this?
I mean, it's changed. It's gotten better. But I still have patients who either deny it or don't want to take it because they think, people still think if they take antidepressants, that means they're crazy. And it has nothing to do with that.
Can you take antidepressants and anti-anxiety medicine when you're pregnant?
Yes.
Yeah.
Okay, so you can.
Absolutely. So that's the one I told you, the patient who kept vomiting, I put her on Lexapro. We have Zoloft is very, very safe during pregnancy. The problem is it takes 4 to 6 weeks for majority of these medications to kick in, at least 4 weeks. But, with the newer medications, within a week, you're out of it.
So you get on medication, you get in therapy, the cloud lifts. It took you from that point 7 years. Were you scared to have another baby, or it just took that long?
Well, both. It took me a few years, and I did all sorts of therapy. I did EMDR, I did ketamine therapy. I was like, once I got going, I was like, oh, we're fixing everything now. Okay, we're dealing with all the trauma.
To, yes.
So I went through all this therapy, and I really felt I had processed my birth. And I thought, I think something that will really make me feel healed is having another birth that's more spiritual and beautiful and magical and all the things that you want from a birth the first time, which is not a reason to have a baby, but it factored into my decision to start trying. And I also envisioned myself with more than one kid. Like I grew up with siblings and I sort of wanted that family dynamic. And so I was like, okay, I'll start trying. During COVID, I started trying and I just couldn't get pregnant. And once you, as I'm sure you either know firsthand or through friends, when you want a baby and you can't get pregnant, there's no hunger, right? Deeper than that. So after like a year of trying and, you know, peeing on the sticks and doing all the things, I was like, we got to cut this short. I'm type A. I'm doing IVF. And I went to a fertility doctor and I did a couple of IUIs. I had a miscarriage. You know, I rode the roller coaster. And eventually I was like, all right, we're going to do IVF. There was nothing that she could see was wrong, but I was getting older. My eggs weren't getting younger. And she was like, you know, you want another kid. Let's do this. So I did IVF, and that accounts for the next couple of years of the age difference between my children, was that I had to go through that process. And then I finally got pregnant with my little girl, and I incredibly sick in pregnancy. I threw up to 40 weeks. But I got the meds this time. Mm-hmm. They helped. I was on medical bed rest. I had a hematoma. I couldn't stop bleeding.
Did they have you on any antidepressants during?
And I went back on antidepressants when I went on bed rest. That's where I was going with this. Thank you. Because I had been off of them in between pregnancies. After I did ketamine treatment, I tapered off of them because I wanted to really, you know, see where I was at, kind of. It took me a long time to taper off of them. That was really important to me. I wanted it to be slow. I didn't want to have any crazy, you know, hormone imbalance or anything from that, or chemical imbalance. So I'd been off of them for a good long while. But when I went on that bed rest, my doctor was like, you might think about taking them because it's hard to be on bed rest, okay? A new doctor. This was a new OB that I delivered my second with. And I immediately took her advice. And yes, I had a different perspective. I wanted this baby. I had the perspective of knowing what it was like the first time. I had been in tons of therapy, but still, I was like, we can't ride this roller coaster again. Yeah. I can't go through another depression. But I was scared to give birth because I know that even in the best of scenarios, like, birth is bloody. And I was like, you never know what's going to happen. You never know what emergency is going to pop up. So I found a midwife on Instagram, the feminist midwife, Stephanie Tillman. I didn't deliver with her. I delivered with an OB.
Midwives are amazing, by the way.
She was amazing because you know what she helped me do? She helped me write scripts to be able to ask for the things that I knew I needed to feel safe in delivery. She helped me make a list, and I went to different OBs in New York, and I said, here are the 10 things I care about. I don't care how you deliver my baby. Take it out of my mouth if you have to, okay? But I don't want to feel pain, and I want to feel safe. So can you please ask me before you touch me? Tell me before you touch me. If something you think is going to hurt me, tell me so that I know to ask for pain relief beforehand. Had I known that I could have had an epidural before my water was broken in the first birth, I would have asked for it. I wanted an epidural anyway, you know? And I had told her, I don't want to feel any pain. I'm terrified of pain. So I made this list with this wonderful midwife, and I went and I interviewed doctors, and there were many who were like, I'm unwilling to comply with these things. One of the things that I really wanted was a doula. And a lot of the doctors that I met with were like, that's a hard stop for me. I don't allow doulas in my delivery room. Okay. So I finally found a doctor who was like, I've never tried a lot of this. But I'm really like, I won't put my feet in stirrups. Okay. She was like, we always use stirrups, but we can try it your way. Like, I'm willing to try. And I was like, that's enough for me just to know that you're willing to try these things, none of which are changes to how you do medicine. Yeah. It's small behavioral things. I just want you to be nice to me. Like, if something hurts and I'm crying, can you just tell me that you'll be empathetic and you'll like hold my hand a little bit, you know, things like that. And I had a incredible birth, beautiful. There were moments that were scary and there were things that hurt, but not 1 second of it was traumatic because I was surrounded. I had an all-female team. The 2 anesthesiologists were both pregnant. They had fabulous fake eyelashes on and amazing nails. And I've never felt more cared for or safe. And it was like, spiritual makes me sound like I'm, you know, nutty, but I really was like, this is miraculous. Spiritual. It's an everyday miracle. And it was the best day of my life. And when my baby came out and I looked at her, I was like, this is what I got, the birth that I should have had the first time. And it wasn't that hard. It wasn't because I asked for anything
crazy.
None of it. It was so basic.
Basic rights.
But I didn't know how to advocate for myself the first time to ask for them. And that list, like it's in my book. I would say to anyone, if there's one reason to buy my book, take a picture of that, take it to your OB and just say, would you be willing to try any of these things if you're uncomfortable in an OB's office? Because like even a pap smear for me is triggering. Yep. And just to have someone be a little more caring goes so far. And now I want like 8 kids and I'm old. So what do I do?
Did you get postpartum?
Not at all. I haven't been on antidepressants. I tapered off of them after I got off of bed rest and I've felt great ever since then.
But there's a big but. She healed herself in between those 2 pregnancies. So with the first one, you went in untreated, dismissed, right? You were dismissed throughout your pregnancy. You had a terrible postpartum depression and you were not treated. The postpartum depression was not addressed. Second time around is exactly what I told you. You have to treat it before you go into it. If you were my patient, with the history with the first one, I would have probably kept you on medication on a low dose of Zoloft during pregnancy just to make sure you don't dip and get into that bed rest mode and have to restart it. These medications are really safe. First of all, it was second child. The bonding is instant because you're a mom already. They put your second child on your chest, you bond. With the first one, it's a little touch and go. And different patients have different experiences. And I want people to know that it is completely normal to feel detached from your first child. But it's normal. It's less common with the second one. But you were ready. You went into this pregnancy. You were your own advocate. You had treated. You had dealt with your trauma. You knew exactly what you did not want and which doctor you didn't want. And you surrounded yourself, I have to say, with women. Because we're the best.
Literally.
And your experience completely changed.
I was giddy when my baby came out this time.
It was
the
so
best.
happy.
It was the best. But like the barrier for entry to that is so high. Like I had to know so much and advocate for myself in so many ways and literally show up with lists and train my husband on all these scripts that I wrote for myself. I wanted to refuse cervical checks. I don't like the feeling of having my cervix touched. Right. It's very triggering for me. I don't like it in sex. I don't like it in the doctor's office. I don't like it at all. And I'm like scared to advocate for myself. I'm like a polite Midwesterner. And I wrote down the sentences. I don't consent to cervical checks. It hurts me and makes me uncomfortable. And I literally would have to like read it, but I knew what I wanted. And I knew that I was going to figure out how to get there. If I had to write it down and read it in front of the mirror 20 times before I walked in those hospital doors, I was going to do it. But for a young woman who has no education the way I do, who has no access to therapy, whatever, how do you, or no money or no resources, how do you advocate for yourself in those environments?
They don't.
And when women, I know firsthand, when I was an unhappy mother, I was not a good mother. It's really hard to parent and care for another being when you are not fulfilled by it and you're not happy and you're miserable. It is a recipe for raising citizens in our world who are not well-functioning contributors to society if we have all these moms walking around that are totally traumatized and messed up by their births. It's such a disservice to women that the medical industry treats them the way they do, because then they cannot be functional parents.
Yeah. That's honestly really true. And so you go through this experience and you decide to write about it.
Yep. I decided I needed to write the book that I wished I had had while I was going through it.
Oh, that's amazing. Well, I love your story. I think women should read it because you do feel alone and we don't talk about things as much as we should. I remember I asked, my number one thing was, am I going to poop? I mean, I've just heard that you're going to poop when you go through that. I'm like, I don't want to poop. I don't want anyone to see my poop. Like, that's like so. But those are just like tiny little basic things that it's not sort of told to you. These are the things that you're going to go through. And you're right, that brain that you have. I remember at 40 weeks, I got checked and I wasn't, same thing, not dilated, anything. And I remember my parents had come out to wait for the baby. It was my first baby. And I remember sobbing, just saying, he's never going to come out. He's never going to. I mean, of course he's going to come out.
Yeah.
But like, you're not in your
rational brain.
It's just so irrational. My mom's like, I promise he's going to come out. I'm like, he's never going to come out. But what for women and men that want to read this book. I think a lot of dads should read this book too.
I think it should be required reading for men.
100%. She always says the dads have to come in to her office, and she
it's important.
Yeah.
It's just like menopause. If your wife is going through menopause, you better know what menopause is. If your wife is giving birth, I had a husband yesterday in my office, and I don't know, she was complaining that, he kept telling her, it's okay, don't complain. So the husband was sitting, and I looked at him. I'm like, here's the deal. Not only you're not allowed to tell her that she's not allowed to complain, from now on, I want you to address her as queen. And you're going to treat her like a queen. And if at 2 a.m. she asks you to go grab her water, you're going to go grab her water. If at 3 a.m. she asks you to massage her calves because she's having, cramps in her legs, that's what I want you to do. And for everything your wife is going through, from getting pregnant, having stretch marks, putting her body at risk of preeclampsia, gestational diabetes, weight gain, stretch marks. I mean, the list goes on and on. Giving birth, pushing a baby out of her vagina, the only thing you need to do is be nice to her. There's no other responsibility for you. We're doing it all. That's all you need to do as a partner. And it's even more important postpartum.
Yeah.
They need to know that they need to take care of the baby. The new generation of fathers are really involved. Yeah. It's different than the older generation. Our parents were not as involved. This new generation, I mean, my husband did more than I did for my children, and he continues to do it. So they're very loving and caring and nurturing. But not having that nurturing partner is also a huge problem. And it makes it harder for women to recover postpartum.
I mean, I adore my husband. He's wonderful. But he wasn't the partner I wanted. After I had a baby, he didn't know any better. He messed up a lot of things. My book is an instructional manual for how not to act as a husband after someone gives birth. But the thing is, I don't think that our culture equips men well. In high school, I never read stories about women's experiences. I read stories written by men. I read like the Odyssey and the Iliad, but I wasn't reading, not that my book should be taught in high schools, but I wasn't reading really honest depictions of what it is to be a woman. And I think that this ability we have to literally perpetuate our species is magical and incredible and a gift, but it's also in a way a huge burden. It takes you out of the workforce for some time. It messes with your body. And I think our culture needs to be set up to like show extra respect for women. Like, I expect my son to be a gentleman because women in this world are taking on far more than their fair share of this difficulty by being the, bearers of our children. And I'm really annoyed that our culture isn't
and you know what's
kinder
funny?
to women.
We are superior.
Sorry,
that's how I see it. But
she said it.
We are superior, and I'm not just saying that. I believe it. We multitask. What we're capable of achieving, even in the postpartum period, is beyond anything any guy can ever do.
It's goddess level.
It's an honor to have you. I think, please, men, women, this is such a great story, and it was so beautifully written. If we can have one takeaway that you want a man, a woman, anybody reading your book to take away from your experience and your book, what would it be?
Well, I've been on this book tour now for a couple months, and I've been talking to hundreds and hundreds of women, and they all have a story. Mm-hmm. There is not one woman who walks through this life unscathed by the traumas of living in a world that is really run by men who don't necessarily come equipped with all the empathy in the world for women and their stories. And I think as we all go through this life, it does not harm anyone to assume any woman that you interact with has possibly been assaulted, has her own traumas, has her own difficulties, especially surrounding childbirth and pregnancy. And kindness and civility and gentlemanliness goes a long way to making women feel safe and cared for in this world. And they deserve that because they make all the babies.
That's true.
So I guess that's a takeaway. It's a big one. I don't know if that counts, but
yeah, it definitely counts. And I think it's a beautiful thing to say.
And I would add to it, be your own health advocate.
Absolutely. Figure out what you want and what you need to feel safe and cared for. And if you have to write it down and stand in the mirror like I did and practice it, do it, because no one is going to stand up for you but you at the end of the day. That's what it means to be a real adult, I feel like I'm finally a real adult.
Thank you again for coming on our show today.
Thank you for having
and
me.
I loved your book. It was amazing.
That means a lot. Such
Thank
an
you
honor
for
to meet
sharing
both.
your story. Thank you for bringing awareness to postpartum depression. And, we appreciate it.
Likewise. Thank you.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.